Hello, today my guest is Dr. Rachael Rooney. Dr. Rooney is a lifestyle medicine physician and she's also a general practitioner, which means she works in family medicine. So thank you very much. I know you've got a really, really busy life, both with your family and with all you do professionally. So thank you for sparing some time for me.
Thank you so much for inviting me. I'm really excited to discuss quite a broad topic today.
Yeah, so we're going to talk about brain health, and I think this is one of the things that as people get older they worry about more and more. A lot of people are frightened that they're going to end up with dementia, maybe because they've seen it with their own parents or read such a lot about it in the media. So today we're going to be talking about brain health and how to keep your brain healthy.
Absolutely, I would agree with that. As a general practitioner, it seems to be one of the conditions some of my patients are most sort of frightened about developing in future. And obviously there's a sense that people are sort of living longer, but we don't just want to live longer and be really frail for longer. We want to kind of live well, really, and have a sort of enhanced health span as well as just a lifespan. And I did a bit of work a few years back in a memory service, so also saw from that sort of perspective, the diagnosis of dementia and the subtypes and the sort of specialist services that could be offered. But that kind of really got me thinking, because dementia isn't just something that suddenly happens in older age. Normally it's a sort of gradual process over perhaps even 30 years or so. So there are things really earlier on in life that people can hopefully be a bit more empowered to start addressing if they really want to reduce their risk of developing something like that at an older age.
Yeah, I mean, a lot of people I talk to seem to think it's inevitable. If you're going to get dementia, you're going to get dementia. There's nothing I can do about that.
Yeah.
And that's very far from the truth, I think you'd say, yes?
Yeah, absolutely. I mean, genetics, even for Alzheimer's dementia, where we know there are a few specific genes that obviously can predispose or make you a bit more susceptible, but even in that case, we're now finding out that the genetics is less important than we originally thought. And they estimate that about 40% of all dementias, so 40 out of 100 patients with dementia, there were sort of modifiable lifestyle factors that might have made a difference if things had been changed earlier on in life.
Okay, so what are those modifiable factors then? That's the big question.
Yeah, so there have been some interesting sort of big meta-analysis looking at sort of lots of studies all combined to try and untangle some of these, because obviously it's quite difficult to research because you're wanting to look at people, right from childhood until they're in their sort of 80s or 90s. So it's not the most straightforward thing to research or do a randomized control trial and give some people one life and other people a different life. But certainly also along with the sort of blue zone studies looking at longevity as well, there are some sort of common themes that come up in quite a lot of the research, and they really tie in too to the pillars of lifestyle medicine, which is the approach that we take as lifestyle medicine physicians. So I suppose the first thing to know is, even with a genetic susceptibility, your genes aren't your destiny. We realise that genes can even be changed depending on your lifestyle with the whole field of epigenetics now. So I suppose that's the sort of starting point. And then one of the recent studies divided the factors that are modifiable into the different phases of life when they might be the most important. So the things early on in life, the things in midlife, and then the things later on in life that can make a difference. So, I mean, starting in early life, educational level is quite relevant to risk of developing dementia later on. So particularly more education up to the age of 20 seems to be quite important. So that's obviously not something someone can necessarily go back and change.
Yeah.
But analogous to that, there's quite a lot of theories that the brain in some ways is a bit like a muscle. That's how I describe it to a lot of my patients. So it needs to be exercised like any other muscle of the body, really. So the things that you can do as you're going on about keeping your brain active, really. So using it in different ways, sort of creative use, sort of more kind of academic use, kind of puzzles, books, interaction, things like that. And I suppose later on in life, one thing I always find interesting is the question of retirement and whether retiring is good for you or not. And actually, there's sort of some suggestions that people who retire earlier then might have increased risk of developing things like dementia. I mean, it's probably not about retirement per se, but certainly having a sense of purpose and something that you're working towards is really important.
And then in midlife, what's important in midlife?
So in midlife, we start seeing things like blood pressure becoming quite relevant. Obviously, within dementia, there are various subtypes. So one of the common subtypes is vascular dementia. So for that, all the things that are good for your heart are good for your brain as well. So obviously, high blood pressure, diabetes, cholesterol, things like that are relevant. But even for Alzheimer's and other types of dementia, there's a connection with blood pressure in sort of midlife. So midlife, they're sort of talking late 30s to 60s. Quite a lot of research studies define as midlife now, because obviously people are living longer and longer. So our definition of later life has shifted a bit. But yeah, in midlife, blood pressure is definitely one to consider. And one of the other interesting things is things like hearing impairment or visual impairment that people don't always realise. And there are a few theories as to why that might be, whether it's sort of just reduction in your senses, reducing sort of all the complex information your brain's dealing with, or whether people can become a bit sort of socially withdrawn if they're not sort of fully hearing or seeing what's going on. But there have been some really neat studies saying the worse a hearing impairment is, the increased risk of dementia later on in life. But it's something that can be sort of fixed with wearing hearing aids. So quite a few of my patients aren't necessarily very keen on wearing hearing aids. And I'm actually a hearing aid user myself, so I've got a big interest in this particular topic. But that's something I would really encourage from sort of midlife onwards, to try and get used to wearing them so you can kind of keep on participating fully. So that's about sort of participation. Some of the other ones in midlife, weight, so BMI. There's more data kind of coming forward about that now. So BMI above 30, so in the sort of obesity range, definitely seems to correlate with an increased risk of dementia. But even small losses, it's quite encouraging, of sort of 2 kilos improves memory and attention in midlife on people who've been studied, which I really like as well, because I think sometimes people can be a bit disheartened by sort of feeling overwhelmed about all these dramatic changes they might have to make. But actually, sometimes perhaps we're better off trying to get millions of people to make small changes that are sort of realistic and sustainable, rather than just a few people make really dramatic changes and everyone else feel, that they can't measure up and a bit embarrassed that they're not as good.
I think it's disappointing that so much of the way that weight loss is talked about is in terms of how you look, and yet something like this, where it can actually reduce your chances of getting dementia, is hugely significant, and we should be really talking about this.
Absolutely. And I would say though, about weight, there are quite a lot of people who might appear, or within BMI range, are normal weight, but metabolically they're not healthy at all when you sort of delve a bit deeper into looking sort of at things like insulin resistance and metabolic syndrome and sort of risk of diabetes and things like that. So sort of weight in itself is quite a crude measure, I think. There are definitely some people more susceptible than others. One of the other major things actually in midlife, sort of connected to what we're putting into our bodies, is alcohol consumption. But that's a really interesting one when it comes to dementia, because too much alcohol absolutely increases risk, and particularly of sort of early onset dementias. So in that case, we're talking sort of more than 21 units a week, so sort of definitely above current UK guidelines. But actually with the blue zones, apart from the Seventh-day Adventists who don't drink alcohol for religious reasons, all the other 4 areas that they study, the people do drink a moderate amount of alcohol, particularly red wine in the sort of Italian and Greek regions that they study. And so they find that a moderate amount of alcohol may be protective. So that's sort of a glass a day, something like that, rather than storing it all up as a sort of alcoholic binge. And actually they find that the teetotalers have slightly increased risk of developing dementia. The heavy drinkers have an increased risk. And there's this sort of sweet spot in the middle, which is sometimes quite a difficult thing to communicate though on a public health level, isn't it? Because we're sort of saying, well, maybe some alcohol's good for you, but not too much. So finding that sort of middle ground, I think.
Yeah, one of my sons works in partly in alcohol research. He's a sociologist, and he says, you know, there's a lot of middle-aged people who are drinking way over the limit, but feel because they're drinking high quality, expensive red wine that is okay. But actually they are drinking a lot, you know, more than is recommended. But they don't see themselves as having a problem because they buy expensive red wine.
Absolutely. I think I'd recommend trying to keep it below 14 units a week, really, which is in line with the current UK guidance at least.
Right.
And evenly sort of spacing throughout the week. And sometimes I suggest to my patients, certainly in lockdown, quite a few people got into a bit of a habit of, you know, relaxing, unwinding, to try a few days without it at all. And if that feels like a little bit of a strain, then sometimes that can be a sign that, you know, you've got into a bit too much of a habit with something like alcohol. But it can be a vicious cycle, because often when people feel under stress, they sort of try and turn to things like alcohol, sort of overeating, kind of smoking, or the other substances. And we know sort of later on in life, smoking particularly is one of the things that people can potentially do to really reduce their risk, giving up smoking. And even studies have shown people in their 60s giving up smoking. It's never too late, basically, to reduce the risk of developing things like dementia. So smoking is really emphasised as one of the things that can be modified. And I think sort of sometimes people do feel, as time goes by, that it's not worth making changes. But I mean, really, the evidence doesn't agree with that. It suggests there's quite a lot that can be done even in the sort of later life phase. So the things that some of the studies highlight there are things like smoking, activity levels, sort of keeping as active as possible, reducing obviously chances of developing diabetes, and keeping up social contact is quite important as well. And that probably sort of ties into mental health as well, because there are some suggestions that depression might increase the risk of dementia as well, particularly in later life.
Yeah, I mean, a lot of older people do seem to get into this phase of being, you know, living on their own, not going out very much, being lonely, and then getting depressed because there's nothing of interest really, or stimulation in their life.
Yeah, absolutely. And I think that ties in with sort of purpose, doesn't it? And sort of life after retirement. And I think sometimes there's moves perhaps in the NHS to kind of recognise the importance of this more, with things like social prescribing and sort of the other services that are important to people, linking them in with them. Because we know that being lonely can be as harmful for your heart as smoking 15 cigarettes a day, sort of being lonely, which is, I mean,
so, I mean, what would you suggest for somebody who's lonely and lacks confidence about, you know, I mean, one answer is, well, go out and meet people, but if you're lonely, you may also lack confidence as well to do that.
It's really hard, isn't it? So I think sometimes it's about starting small, and there's evidence, they describe them as micro moments of connection. So even sort of taking tiny opportunities sort of in your daily life, having a bit more of a chat with the postman or the person in the supermarket, or, you know, the people when you're crossing the road, even sort of relatively small things that are just kind of authentic moments of social connection. And even particularly in this lockdown world, obviously digital interaction and social media gets a mixed kind of message. And if you're just sort of scrolling through things, you know, spiraling and comparing yourself to others, then no, it probably isn't great for your mental health. But if you're taking it as an opportunity to kind of connect with new people that you might not otherwise get a chance, or keeping connected with people from your past, sort of family members or old friends, because there have been some real challenges this past year, and quite a lot of GP surgeries now have social prescribers as part of their kind of community team that often receptionists know about and GPs know about. And they're really useful because they know about the sort of local specific resources. So sometimes there are sort of befriending services through the telephone. There are sort of local kind of community groups, University of the Third Age, kind of men's sheds, because men particularly seem to be quite vulnerable to the sort of health impacts of of loneliness as they get older. So I think it's about kind of trying to find the opportunities where you can. We know romantic relationships are good for you as well. They enhance longevity, reduce the risk of developing dementia. Sex at any age is good for you. You grow new neurons in your brain. It promotes neurogenesis. And there's also really interesting data from the Blue Zone trials that being part of a sort of spiritual organization, so finding a sort of tribe of people, and it doesn't matter, you know, what denomination, there are all sorts of different religious groups, but it's probably the act of sort of participating in something, sort of attending those sorts of services, whether virtually or in person, was beneficial and extended. They thought between 4 and 14 years to life expectancy.
Wow.
Being
Wow.
a regular worshipper.
Yeah. Yeah. I guess I mean, I think it's about having something bigger than yourself that you're involved with as well.
Yeah, I think it's really important. And we mentioned sort of digital connections, even things like pets as well. A connection with a pet, like a dog or a cat or things like that, improve a sense of connection and enhance well-being. And then sometimes it's about the things like sort of physical touch, kind of hugs and holding hands, and even with sort of carers or people who are kind of more formally kind of involved in looking after someone. And we know things like receiving compassion and giving kindness to other people boosts our immune system, and people recover more quickly after operations and illnesses when they're looked after in a compassionate way. And I think sometimes in a really kind of hectic, busy world, we just get very focused on numbers and medicines, and we forget all the other kind of holistic things that are really important to the kind of sense of well-being.
But I think we as individuals can really sort of help people. I try much more now these days because I'm aware of the important, you know, how many people are lonely and all this sort of thing, and about these micro moments as you described them. You know, I try sometimes when I'm standing in a queue, you know, in a shop. I mean, not that now you're so far apart, but
with your mask on.
That before, when you were able to stand close to someone, you know, I'd often try and get in conversation with somebody behind me, because, you know, that person might be lonely, and try and just have a little chat about something. And you know, I try and just sort of do my little bit to help other people feel less lonely.
And it helps the person sort of doing it and the person receiving it. It's a sort of
I always feel better afterwards. As I walk away, I was like, that felt nice.
Absolutely. My children certainly play their part in talking to anyone that we come across. In the park, on the way kind of to and from school. I suppose another option actually sometimes for people feeling lonely is to try sort of classes or opportunities to do new things. And we know that that's really great for your brain as well, because as soon as you sort of master a skill and it gets easy, your brain almost slightly switches off. It kind of moves to the autopilot part instead, rather than this is hard, you know, we need to make some new neurons. I mean, we didn't even really think that adults kept making new neurons in the brain, and now we really know that they do, particularly in the parts of the brain to do with learning and memory, like the hippocampus. So doing something, particularly for example something physical, but something that's a new skill, so learning a musical instrument or yoga or Pilates or kind of board games where you're moving things around. And some areas, sort of, we have a community centre in our village that has socially distanced classes now sort of resumed. So sometimes you walk past the sort of open fire emergency doors, seeing people, you know, doing their different poses and kind of trying something new, which is really important.
What about sleep? Is sleep important in terms of the brain health?
Yes, it is. So quite a few people describe sleep as the opportunity for your brain to sort of clean itself out, basically, and sort of reset. So if you think of your brain, you know, as any kind of factory, it's kind of making waste products of all the reactions that are going on the whole time. So you've got a system called the lymphatic system that removes the buildup of proteins and waste products in your brain. And it's sort of working all of the time. But when we're asleep, it's 70% more active than when we're awake. So, I mean, sleep is, really can't underestimate the importance of that. And there used to be a sort of feeling that as you got older, you didn't need so much sleep. But actually, quite a few researchers dispute that now, and they say sleep is still as important as ever, and you want to be averaging 7 to 8 hours a night. If you're not, perhaps sometimes there are kind of medical conditions or lifestyle factors that are sort of impacting your ability to get a quality night's sleep. Because we know when you're sleep deprived, you don't make as many new neurons. Your performance with sort of memory and attention can be like being drunk. Once you're building up a real sleep deprivation.
So what sort of medical conditions could be involved if you, for an older person who's not sleeping well?
Well, I mean, there are quite a few. So, I mean, one of the common ones is the sort of obstructive sleep apnea. So sometimes that goes hand in hand with sort of snoring, potentially like a raised neck circumference. So your sort of breathing isn't so good overnight, and then it startles and sort of wakes you up to get a bit more oxygen. So that's a big one. And we know that untreated obstructive sleep apnea increases your risk of depression and dementia. So that's really important if you're sort of someone's reporting you're snoring or you're really not feeling refreshed in the morning, to consider that. Obviously, there are some other conditions as well. Quite often people are waking up multiple times in the night to go to the toilet. That can be quite a big one, especially men with sort of prostate issues or anyone with diabetes. If that's not well controlled, that can be another reason to be waking up to go to the toilet. Or if people's hearts aren't pumping as effectively and they're getting a bit swollen in the ankles and the legs, then sometimes they go to sleep, gravity drains off all the fluid, and again they're waking up to go to the toilet. So
right.
that would be something to talk to your GP about, definitely. And then sometimes poor sleep reflects more, the sort of insomnia type conditions, which can be kind of secondary to mental health kind of concerns. If people are depressed, sometimes they're waking in the middle of the night. If they're very anxious, sometimes they're struggling to get to sleep. They're sort of ruminating and worrying about things. So there are definitely quite a few things that can be done to try and address sleep. And I think sometimes we need to reframe our way of thinking about sleep. Sometimes people are a bit like, oh, don't want to have to go to sleep, it's a waste of time, or there are other things to do. But actually it's almost like an investment in tomorrow, getting a good night's sleep.
Yeah. I personally use Headspace for when I can't sleep. They've got some wonderful sleep music on there that sounds like an orchestra tuning up. And if I find I can't go to sleep, then I put my headphones on and listen to that, and off I go.
Yeah, that's a good one. There's another app called Sleepio, which quite a few NHS commissioning groups have kind of approved for patients to download, because often it can be a bit of a vicious cycle. People don't sleep well, and then they start worrying they're not going to sleep well, and then that sort of makes it worse. So quite a lot of things connected to sleep are the sort of habits that you perhaps got yourself into, and trying to kind of break and reset some of those can be helpful. But yeah, absolutely. Sleep's an important one for brain health.
And anything else, or have we? Well, nutrition, I guess, is important.
Yes, nutrition. That's always the sort of can of worms. So I suppose we've mentioned a little bit obesity, and that sort of healthy weight doesn't necessarily mean metabolically healthy. I mean, when it comes to diet, probably the strongest evidence for reducing the risk of dementia is for the Mediterranean diet. So that's the one that the sort of World Health Organization say is worth considering, where you're sort of plenty of plants, vegetables, healthy fats, fairly minimal to lower amounts of sort of meat. In the blue zones, they look at people are sort of consuming meat perhaps 4 or 5 times a month, so probably less than most people having a standard Western diet would. Plenty of beans specifically, sort of soy, lentils, fava beans, black beans sort of feature in the centenarian diets. But I think probably one of the main things is caution with the ultra processed foods, and particularly in the UK and in the US at the moment, they think about 50% of what we're eating will come under the kind of ultra processed definition, which is where when you look at the back to see the ingredients, there are hundreds of ingredients.
Yes. And you don't recognize them.
Exactly. So you want your food to just be eating the ingredients, if you see what I mean, where everything's recognizable. That's probably the least kind of controversial advice that people would give when it comes to kind of healthy eating for brain health. There are a few sort of specific things to think about. So generally, before a GP would refer someone to a sort of clinic to assess further for dementia, you would want to exclude things like a B12 deficiency or a folate deficiency or very low iron levels, because those can sort of be conditions that might mimic having dementia. So kind of considering that you're getting enough of those in your diet is something to think about. But I think when it comes to nutrition, one of the things I feel quite strongly about is sometimes we're very focused on what people are eating. And obviously you can look at lists of eat this, don't eat that. And I think sometimes we neglect to think so much about why people are eating and how they're eating, and also when they're eating, which I think is really quite interesting, because from the blue zones, they find that people tend to eat more of their calories earlier on in the day and stop eating at sort of nighttime, because it fits with a more natural way of life. And there's quite a lot of evidence that having that kind of fasting period of at least 12 hours overnight can be really helpful for your body cells to kind of reset themselves and not be having constant sort of glucose and insulin just kind of dropping down and having a reset button. So for a few patients, as well as, patients trying to lose weight or patients who are kind of pre-diabetic, one of the things that I often suggest is sort of look at when you're eating the food that you're eating and consider some sort of tweaks with that. Look at how you're eating. So it's really amazing that people's glucose and insulin levels respond differently to the same food if it's in combinations with other types of food. So if you're sort of eating your sort of complex carbohydrates with some fat and some protein, versus if you were just sort of snacking on them, eating them by themselves, and your body can respond differently, which is pretty amazing.
So it's better to have the complex carbohydrate and with the protein and the fat all together. Yeah,
absolutely. And so when we're looking at the Mediterranean diet, something that sort of always reminds me, because I'm quite partial to pasta, do love pasta, but the way they're eating it, they're having their salad, their fish, their vegetables, and then their small portion of pasta. They're not just having their sort of bowl of pasta by itself, and things like that. The sort of sequence of eating really makes a difference, and sort of eating seasonally as well, a sort of more natural way of thinking about what you're eating at different times of year, thinking that it might be quite natural to gain some weight in the summer and lose some weight in the winter, considering that over the course of your life as well, your sort of requirements and ways of eating might need to adjust as well. Particularly sometimes menopause can be a kind of challenging time for women getting that nutritional balance. And what's really interesting from a dementia perspective is chewing your food helps grow new neurons in your brain as well. And then you think when people are in care homes and the type of food they then start being given, and it's all sort of soft and mushy, and obviously sometimes there are reasons for that, but that's not ideal, is it? And keeping hydrated, sometimes people underestimate as well. Really important, because all the reactions in your brain require water as a sort of substrate. And thinking about why you're eating, because just sometimes it's quite easy, particularly related to stress, I think, as we mentioned, along with sort of alcohol and smoking, for some people turning to eating certain types of food, and often, unfortunately, it's the ultra processed foods, the kind of comfort foods.
We reach for the biscuits, the cake, the chocolate, I don't know,
and they're designed to do that. The food industry, they find the bliss point, they find the optimal fat sugar combination so that they have sort of addictive like qualities, because it makes sense. So I think sometimes people feel very guilty or very ashamed that they do that, and I try and reassure them there's nothing that's gone wrong with them. They're not broken. Our bodies want to seek pleasurable things. It's sort of what we do, but it's just modern life has so many things to offer that in the moment might be enjoyable, but obviously long term can potentially have consequences.
I read some research ages ago about getting teenagers to eat healthily, and one of the things it said there was one thing that works is explaining to them about how the food industry manipulates their taste in exactly the way you've just been describing. And they said, the natural rebellion of teenage years will often lead them to say, well, I'm not going to eat that then, because I'm not going to be manipulated by these Coca-Cola or McDonald's or whatever. And I sort of feel as older people, need to harness our inner rebel as well and say, I'm not going to eat all this crap, because
I think that makes sense.
You know,
Absolutely.
it's these big companies that are making money out of manipulating me. And I'm not going to let them do that. So, yeah.
And all the cultural messages that are sort of tied up with food, sort of treat yourself. And you think, well, is it really treating yourself? You know, having a big sugar hit and a load of fat that you don't necessarily need, or sort of, you know, reward yourself. But one of the interesting things about trying new things, I don't have teenagers yet. I have 3 small children, and I try and encourage them to try new things, fruits and vegetables. Is apparently your taste buds sort of cycle on about a 3-week cycle. So when you sort of reduce, say, your sugar, you know, often sometimes people do almost feel a bit of a sort of withdrawal and nothing sort of quite tastes right. But normally after a couple of weeks, once you kind of stick with it and persevere, then actually it often seems to heighten your senses, and then you sort of notice the natural sugars more in things like fruits and vegetables and things like that. So I keep telling them to try something in case they've got some new taste buds that have changed.
Oh, that's a great thing to say to a small child.
Yeah, sometimes it works. They'll give it a try. They give it a try at least. But I suppose, you know, when it comes to blood sugars and diabetes, we definitely know that correlates with a risk of dementia. And it's sort of a tricky one, because I think quite a lot of the NHS care for diabetes is sort of focused on once people are diabetic already and then trying to control it. And ideally what I'd like to see is more focus on sort of pre-diabetic or people who are high risk of developing diabetes, because, you know, we've got lots of lifestyle medicine evidence now that with lifestyle changes you can really kind of stave off ever potentially developing diabetes, or certainly sort of getting it into remission without medication potentially for a lot of people. So I think that's an area that would definitely benefit from a bit of focus.
Yeah. So in general, I mean, you've made it really clear there's lots and lots of things we can do. And obviously you can start when you're very young, but even if you're 50, 60, 70, 80 year old, you can still make changes that can significantly impact whether or not you get dementia.
Yeah, I think so. I think it's helpful to sort of see it that way. Obviously, some people are going to be more genetically at risk. But I think it's helpful to focus on the more kind of empowering things that we can potentially change or do. And sometimes there are sort of relatively small tweaks. But I think one of the difficult things, though, can be that a lot of this advice seems quite simple, or it seems quite intuitive. But simple things or common sense aren't always common or easy to actually do. So often I think there's a bit of a gap between intellectually knowing and understanding something and then really implementing it. So it's about, I suppose, trying to find the values that are sort of important to people. And often, you know, as I said, a diagnosis of dementia would be something people would really want to avoid, but then trying to find a way to kind of introduce some of the small changes that sort of fits with their life and their current kind of setup, and trying to avoid a kind of all or nothing, got to have these really extreme kind of health regimes, which, you know, work for a few weeks and then people kind of slightly fall off course and then they get disheartened and they sort of bin it all, and trying to do things that are a bit more sustainable, really.
Yeah, I think that's right. I think people who succeed are people who take one thing and get that as part of their life and then go, okay, that's now habit, it just feels normal. What do I do next? And just keep on adding things.
Yeah, and I like some of the research that's quite pragmatic, because there are some sort of papers that says, well, you know, jogging is really good. Jogging reduces your risk of dementia. But then on the flip side, some of them also acknowledge, but jogging does take quite a lot of time. So do you want to use up all your time jogging so you can sort of live a bit longer without having dementia? Or do you want to find a type of exercise that actually you enjoy and maybe kill a few more birds with one stone? Sort of things like dancing, which really all cultures that they've sort of discovered have some form of dancing, and then you can combine it with a bit of connection with people, or, as we said, the sort of exercises that engage your brain a little bit more, the sort of yoga, Pilates, things like that. I mean, obviously, if you love jogging, then jog. But even in the sort of exercise studies where they look at mice and they look at mice developing new neurons and parts of their brain, there's a difference between the mice who are forced to run and the ones who choose to run, and they only get the benefits when they choose to do it. So sort of trying to force yourself to do something and kind of white knuckling through it isn't always really the answer either. It's about finding something that works for you.
Yeah, yeah, and it can be also, there's lots and lots of different possibilities, isn't there?
Mm-hmm.
I could go on talking to you all day.
There's quite a lot to talk about potentially, isn't there? It's a really massive, really interesting topic. I was just having a little look through because I made a few notes because, you know, I was just like, oh, so many things, what to say. And I think there are just a couple of things. So let me just also mention, because I thought they were really interesting. Pollution. So living on a main road increases your risk of dementia. Obviously, that isn't always within our control, but there are quite a lot of researchers in dementia who say when they take the opportunity to go walking, they pick the less polluted route to go walking, which I just thought is sort of interesting. And some of these things are obviously environmental and something that we need to be considering from a kind of whole population level. But where individuals do get choices, that was one to consider. Head trauma, so head injuries, and they've sort of looked at military veterans and soccer players specifically can increase the risk of dementia in later life. Boxers potentially as well. So I suppose just considering kind of taking precautions insofar as you can with things like that might increase your risk. And also oral health and the microbiome is obviously an area that's coming under more and more research. And there are some people who go so far as to talk about a sort of potentially infectious trigger for dementia and it being something through sort of bacteria in the mouth. So that's just worth considering.
Oh, that's really interesting, isn't it? So you need to go to the dentist, go to the hygienist and floss your teeth regularly.
Yeah, and consider sort of with your microbiome in your gut, the things you can do to promote good health there. So, I mean, that's mostly about fibre being really important. We don't really eat enough kind of plants and fibre, and avoiding unnecessary antibiotics, because obviously that really can deplete your gut microbiome, and other things like considering sort of probiotics or prebiotics, but that's a sort of quite big area in itself. But those are some of the other things that come up as worth considering. Mm-hmm.
Thank you very much. You've actually touched on a great deal of different topics, and we do have more on some of those topics within our site. So thank you very much indeed. I've loved talking to you. Lots of practical things that people can do, which is great. So thank you very much indeed.
Thank you so much for inviting me.